Welcome to the Tech Talks Daily Podcast, where you can learn and be inspired by real-world examples of how technology is transforming businesses and reshaping industries in a language everyone can understand. Here is your host, Neil C. Hughes.
Welcome back to the Tech Talks Daily Podcast, where we talk about how technology is impacting every area of our life, business and world every single day. And let me tell you, delivering a daily tech podcast on a variety of topics can be incredibly challenging because I don't want things to get too samey. So for that reason alone, I'm incredibly excited to get today's guest on with his unique solution. Because I think we are all kind of just assumed that from the moment we wake up in the morning, it will just be another Groundhog Day where you know every single thing that's going to happen in every single moment, right? But when we least expect it, our entire world can come crashing down with a healthcare emergency for yourself or even those closest to you. And if anything like that was to happen, do you know your or their wishes and beliefs? Now, Jeff Zucker is the CEO and co-founder of a company called My Directives, and they are the world's leading all-digital advanced care planning platform that is empowering users to create, store, and update and share high-quality digital advanced care plans should the unthinkable happen, or even upload a paper advanced directive and portable medical order in case of that healthcare emergency that none of us think will come. Now that gives the person and their loved ones the assurance that voices can be heard if they suffer a horrendous healthcare crisis and just cannot communicate with doctors, nurses or caregivers themselves. The very thought of that is just unthinkable and scary, isn't it? But My Directives works with personal health records and electronic medical record vendors, as well as healthcare providers and payers, to ensure that all information is securely available on demand, whenever and wherever needed. Just like you listening at home or wherever you're listening to this podcast, I have experiences, grief, family health problems, and all those other nasty surprises that life can throw at you, all when you least expect it. But when it does happen, it kind of wakes you up from sleepwalking your way through life and almost gives you a sense of purpose. So if you haven't had one of those experiences in your life yet, please, I urge you to listen to today's show, watch the TED Talk that will be attached to the blog post accompanying this episode over at techblogwriter.co.uk/mydirectives, and try and learn from the experience of others out there and how your smartphone could help you when the unthinkable may or may not happen. And I have had a good run, but after 1,100 podcast interviews, Jeff Zucker is the one that brought a tear to my eye. But enough from me, I've probably revealed too much already. So let's get Jeff Zucker, CEO and co-founder of My Directives, onto the show now. So a massive warm welcome to the show. Can you tell the listeners a little about who you are and what you do?
Good morning, it's Jeff Zucker. I'm the CEO and co-founder of AD Vault. We're based in Dallas, Texas, and we're trying to do our part to disrupt healthcare and give people a voice in their care.
Now, you guys first appeared on my radar when I read about My Directives, which is the first completely digital emergency, critical and advanced care programming service that is secure and easy to understand and free for consumers to use all over the world. But for people tuning in and just hearing about it for the first time, can you tell the listeners a little bit more about exactly what it is?
Absolutely. The company is 13 years old, and we spent 6 years trying to quietly understand why healthcare hadn't solved a problem before. A very simple problem that lets doctors know something about the people they treat. And it lets people who go into the hospital, who have an emergency, who have a sudden health crisis or a long-term chronic condition, it gives them confidence that if they are in an emergency situation, that the doctors are going to know something about them. And the concept in the old world was called an advanced directive, or in your world, an advanced decision and statements document, a paper document where people answer questions, and that document is supposed to help guide the medical treatment plan in the event of a crisis. The problem was most people didn't create the documents, and if you did create it, we couldn't find it in the emergency. So you were asked to try to recreate it during a crisis, which is exactly by definition not the right time to try to answer some important questions. So our view was to help the healthcare world do something that it's been trying to do for decades, and that's get the paper-based document in the hands of doctors in a meaningful way during a crisis. And we branded it under the concept mydirectives.com or mydirectives mobile. We went free live to the consumer marketplace in 2012 with very little marketing, just word of mouth. And we wanted to watch to see the social media heat map and where people would share it with other people. And we now have users in over 50 countries, including all of the United States and throughout the United Kingdom. And what they're doing is just going to mydirectives.com or mydirectives mobile, and they're answering some questions, and they're sharing it with their family and their friends and their doctors. And we remind them at least once a year, are these still your wishes? Neil, are these still the people that you want to speak for you? And is this still the right way to reach them? And you might remember, oh yeah, I've moved away, I need to update that. Or that person's no longer in my life. Or no, I'd rather have somebody else closer to me making decisions. And so you can keep it updated and current. And when you do, it's a more meaningful document when and if it's ever needed.
And I urge anyone that's listening to this podcast to pop by your website and have a look at some of the videos and how it actually works, because I love how you're using technology to give people and their loved ones the assurance that their voices can be heard if they suffer that unthinkable healthcare crisis and just cannot communicate with doctors, nurses, or other caregivers. But I'm curious, just for everyone listening, does that kind of video testimony hold up if challenged legally by an upset or angry family member? How do you get around things like that?
Well, that's a great question. And the fact is, you never know until it's actually brought into court, if it's even brought into court. But what we've seen is that these video messages and the answers that people give at mydirectives.com and at mydirectives mobile, and that they share with their family and friends, they're usually done so authentically and so honestly that it disarms the family member that might have otherwise objected. And in the old world, the person that objected and actually forced into a court or got into a very contentious situation was someone who usually had a different challenge with the family member and had some guilt and had a problem letting go or had a problem allowing someone else to make decisions. And what we have found is that when there is a video message that says, I love you, but please let her make decisions for me because she lives next door and she takes care of me and she knows who my doctors are and she's with me every day of the week. And even though you're going to fly in from out of town and try to act like the big brother, I still love you and I want you to respect my wish to let her make those decisions. And that usually disarms enough where we don't see these going into a legal court to be challenged. But in the event that they are, the beauty of the digital world is that we have lots of digital markers, geolocation, and time and date stamps on the video messaging, on every entrance into mydirectives.com and the typing of answers. So there's a clear audit trail that makes it very clear when things were done. And if someone, hacked into the system and it could be proved that somebody else did it on their behalf, then quite frankly, then that document shouldn't be the spoken voice for that user. It should be put aside and let a real conversation happen at that point in time. So we're not hiding behind anything. We think people should have a voice in their care. They should live with confidence that they can. And the beauty of the digital world and all of this complicated technology is that it cannot just enhance people's voice. It can really give doctors and family members confidence that it is you.
I completely agree with the sentiment behind that as well, because I think the old way of doing things, people would have been presented with a legal document that contained nothing but legal jargon with no intonation or no emotion. And that's an incredible emotional time. And people need that emotional connection from whatever message that they're receiving, don't they?
Absolutely. We did a study in the UK with your organ and blood transplant folks. And this is before the UK had moved to an opt-out policy on organ donation. And they found that there were some family members who rescinded the organ donation rights as expressed by the patient when they passed away at the end of life. And then we went back and looked, and had the family members seen a video that said, "Mom and Dad, I love you, and I hope you'll love me enough to respect my wish to let me be an organ donor, even though I know it's not your religious belief. It's something I want to do if something happens to me." That those videos invariably helped the family agree with the citizen's decision to express their voice and want to be a donor, which makes everybody feel great. And in the event that the family still didn't support the decision, the medical teams now had confidence that it really was the right view of the patient and that they could respect that patient's voice by letting them be a donor as well.
So how does it all work then? Can you walk me through a few scenarios just to help everyone listening understand how it could help them and indeed their families or loved ones?
Well, one of the powerful things we've done at mydirectives.com is to make the entire platform free to consumers. So anybody, anywhere in the world can go to mydirectives.com and create a free account and start answering some questions. And it just takes a couple of minutes. And if you're not done, you can pause and come back later. You can sign your document digitally and then decide a few moments later or a few weeks or months later that you want to come back and update an answer or maybe add another answer you gave some thought to. And after answering some questions, you sign it. It stays in the cloud. You're able to share it with family members or friends if you like. You could just notify them that you've done it and not give them access to it until there's an actual crisis someday. So it's not as if they need to see anything on day one. That's your choice. You're the consumer. It's your data. You get to consent to who sees it and who doesn't, and you get to watch and see if anybody looks at it. And you sign a release form with us that lets us share it in the emergency room if there's a medical crisis. And that's the point for using the system, is to have your voice heard in the event of a crisis. So we empower you with a wallet card, with a QR code, with the mobile app, with lots of links that we give you the opportunity to share with doctors and family and friends to let people know that you've done something. You can post something on your Facebook. You could post something in social media of your own to alert people to the fact that you've done it. But then part of the magic of what we've done as a company is the big enterprise, what we call the piece of the iceberg underneath the waterline. And that's all the connectivity to hospitals and electronic health records and to doctors' offices all over the world, so that if you had a crisis, they can reach out into the cloud and find it and get it in a secure way. And getting the consumer's voice into the electronic health record in a secure way is part of the novel first time innovation that we are proud to have been able to help bring to healthcare.
It's an incredible thing what you've created there, especially because it's free for every single person around the world to go in and create this account. But how do you work with doctors, nurses, caregivers, and other partners? How does that fit into everything?
Well, we all know that healthcare is not as common sense and as organized as we'd like to think it would be. So you have to do lots of things to triangulate around behavior change. You have to reach out to doctors and nurses a variety of different ways, directly and indirectly, so that they're aware of something that's out there and that they take a trusted connection to our database and respect the voice that comes out of it. We say these problems were not created overnight, so they won't be solved overnight. And it's a constant effort to reinforce and to educate and to encourage the normalization of creating advanced care plans, and we securely store them, and then getting them accessed and found in the emergency setting so that people can have a voice. It takes a village. It's not just a cliche. We have to work with doctors and nurses and lawyers. We have to work with employers and health insurance plans and government agencies. We have to obviously work with consumers and their family and friends, and everything from primary care doctors to specialist doctors. And it is a belief of ours at our company that everyone deserves to live with confidence that they could have a voice in their care, and they shouldn't have to pay anything to have that voice heard. And that's why we've committed to do what we have done to make it free to the consumer. We charge the health insurance world to help us put their populations on the system, and then we charge the medical community to get a secure API, a secure connection to our database, so they can feel confident they're getting a safe, secure feed that gives them access to a person's plan and the most recent version of that plan and all the data reporting and analytics that come with that to give them that confidence. So if it weren't for the health insurance plans and the ministries of health that help put people on the system, and it weren't for the doctors that paid to touch the database in a secure way, we wouldn't be able to do this for free to the consumer. But the beauty is that we have tapped into a belief across the entire spectrum that everybody wants to help people get a voice in their care so that we can be more respectful and do things to people that they would want done and not do things to people that they don't want done.
And of course, I'm talking to you in Dallas, Texas today. I'm here in the UK. We've both got very different healthcare systems out there. And of course, we will have people listening all over the world with even more different healthcare systems out there. So do you serve the whole world? And if not, do you have any plans to expand beyond that? Who are your markets at the moment?
So we went live in 2012 with no geographic border of any kind. Again, our view was that everyone over the age of 18 should live with confidence they can have their voice heard. And we really didn't know where people were going to be when they created their plans. We didn't know where they were going to be when they were going to have a crisis and need their plans. So we have users now in over 50 countries, all 50 states of the United States, every region of the UK, Wales, Northern Ireland, Scotland. We see plans being created in all of these locations. We see plans being shared in all of these locations. And we see an increasing number of doctors all around the world accessing the system to use the plans in the event of a crisis. And it's a really exciting time to be in healthcare where there's this convergence between all of these rapidly accelerating digital technologies, all of the cost factors that are driving people to look at healthcare in a reform mindset. But at the end of the day, just as we've seen in so many other industries, it's the consumer that wins out. It's that very populistic view that you deserve to be able to make your own travel arrangements. You deserve to be able to move money between your checking and your savings account and not have to stand on the line at a bank to deposit a check. That you deserve to be able to share information as you see fit. And when it comes to healthcare, the consumer-centered model in healthcare is a very powerful one that we are thrilled to be at the forefront of trying to help and encourage anywhere in the world. We've had people all over the world with health issues that are able to get their voice heard. And we've had people on cruise ships and ocean liners out in the middle of the Atlantic Ocean in international waters with no state or country laws to actually guide them or to feel fearful of that they would prevent them from getting their voice heard. The ship's doctor can literally go into the cloud and pull down someone's advanced care plan and know something about them and treat them better.
And I've spoken with, I think, around 1,100 different tech leaders on this podcast now. And a lot of people always ask me, do any of these tech leaders and people that are creating these solutions of the future, do they have anything in common? And I'd say most have been severely affected by a particular problem or pain point and then gone away to do something about it. So I'm curious, what's the story behind My Directives and your passion for healthcare tech? Did you come across or encounter any pain points yourself?
Well, yes. The answer is yes. Scott Brown and I, as the co-founders of the company, each had a couple of experiences in our personal lives that probably didn't go as well as they could have gone. Yeah. And the desire was to try to do something to have those sad situations not be in vain. And they motivate us every day. And the amazing thing about the team that we've been so fortunate to have here and build at our company, and the people that we are so honored to work with at our corporate and healthcare partners all around the world, is that everybody has a story. And we find that everybody's story is a little bit different, but all rests on the same premise that somewhere, somehow, someone did not get their voice heard in their care. And maybe the outcome was good, maybe the outcome was bad, maybe the outcome was less bad, but all of us are joined in this concept that if someone had had a chance to have their voice heard authentically and honestly in a timely way, that something better might have happened. It would have been a better experience for them and their family. Clearly, for the fantastic doctors and nurses who do the hard work every day of treating literally strangers who get wheeled in to the emergency room. We know nothing about who these people are. We don't know their hopes and their fears and their goals of care. We don't know who legally speaks for them and what we would want those people to do or not do. And so doctors and nurses really need this information in order for them to honor their obligation to themselves and their profession to do no harm and to treat people with respect. And it's so hard to do that if you don't know what really matters to the people that you're treating. So on the one hand, the massive disruption that we've created and are creating with my directives is a very complicated and a very sensitive and secure issue that is being handled in very sophisticated technology terms to empower people to have a voice in their care. But when you actually take a step back and realize that all we're doing is helping two people communicate, and by definition, they need to communicate because one of them is slightly impaired or significantly impaired, but that's why they're in the emergency room. And then you take a step back, and we every day at 80 Volt say, in the year 2020, should we really have this issue be this hard? Isn't it possible that we really can help people have a voice in their care and help doctors know something about the people they treat? It's an exciting time to be involved in something so sophisticated and so disruptive, and then yet so simple at the exact same time.
And I've not created an account yet. I promise you I will do at the end of this because I'm feeling incredibly overwhelmed by the stories and the information that you're sending me here today. But am I right in saying it's not just about advanced care either, that you could just be recording a message to someone to tell them how you feel in the future that you can't now? Well,
we don't discourage you from using the platform to express yourself any way you'd like. We recognize the audience is going to be the emergency room doctor and nurse, the caregivers, the family and friends. If you note that you want one message to be for a family member and one message to be for a doctor, then that's how it will be delivered. But our view is that when you take the time to do this as the user, you actually live a better life. Because you're less worried that you'll lose control or you'll lose your voice or that someone won't know something in the future. So even if there's no crisis, even if that message is never heard, there's an incredible peace of mind. There's an incredible joy that comes from knowing today you've checked the box and you've taken care of something and you're not as worried about it as you might have been otherwise. So we talk about how My Directives helps people live better lives. And we hope, almost like any insurance product that you might buy, we hope you never need this. We don't want anyone to ever be in a crisis and actually need My Directives to be used to have their voice heard. We'd love for you to be able to communicate with every doctor if you were to have a need to go visit a doctor. But on the off chance there's a crisis, and unfortunately there are millions and millions of those every single day around the world, the My Directives platform is there to give you that sense of confidence. You can have a voice in your care. And before we started recording this podcast today, we was having a bit of a chat, and I was saying to you that I think very often we're all guilty of just endlessly scrolling down our smartphones, whether it be LinkedIn, Facebook, Twitter, whatever it might be, when we could actually be investing a little time in just making sure we avoid those future problems. And you told me a great story about a TED Talk and the people to have the first selfless selfie. Can you just tell me about that story, just for everyone listening? And what I'll also do on the blog post that will accompany this podcast, I'll embed that TED Talk as well, just so people can go back to that story too. Sure. The TED Talk we were honored to do a couple of years ago was about truth telling. And we had been asked before to do TEDs, but we chose this one because the theme was so appropriate. And it was about using technology to tell the truth. And we believe your truth is defined by you. And really no one else should be trying to decide what your story is for you. That's your story to tell. What are your hopes and fears? Who do you want to speak for you in the event that you can't? And what would you like people to know? And the best way to record that, or one of the ways to record it, is just pick up your smartphone and record a message. We call those messages the most unselfish selfie. And we really think that the millions and millions of people all over the world, billions of selfie videos that are taken every day on all sorts of random concepts, have really set the stage for the most powerful disruption in healthcare that we might see in our lifetimes. And that's because if everybody has done a selfie video at one point in their time, then the act of doing a selfless selfie is really a lot easier. And that message can make such a profound difference in the way you live, the way your families live, and the way doctors are able to treat you in the event of a crisis, that you truly have the power in your own hand to revolutionize healthcare. And as we said before we went on the air, we like to focus on cancer research and all of the sophisticated biogenetic research and medical devices and the sophisticated engineering that goes into transforming healthcare and solving some massive problems. The experts need to focus on that. What all of us can do, we have the power in our own hand to do something for ourselves and to truly disrupt healthcare and improve the quality of care that everybody gets, dramatically changing the cost curve, because all of that confusion, all of that chaos is incredibly expensive and really impacts the ability for doctors to make real-time decisions in a very stressful environment. And so every one of your listeners has the power to take their phone, make a video message, answer some questions at mydirectives.com, store it in the cloud, share it with some friends. You could be done in a few minutes and have done a massive, massive thing to improve healthcare all over the world.
And despite that and the ease of it all, I recently read a stat that I think it was 74% of adults in the US alone don't have an advanced care plan. And from your experience and the conversations that you've had, why would you recommend to listeners that they should create one?
Well, statistics show about a third of the American people have an advanced care plan. It's a little bit less in Western Europe. It's about a third in Australia. This is a global problem. It's a global opportunity to give people the chance to have a voice in their care. And so we help employers, we help health insurance plans, we help governments use the marketing devices that they can to make people aware that they have the opportunity to have a voice, and it is their voice that needs to be had, not somebody else's for you, but you for yourself. And if you don't express yourself, then who will on your behalf? And you're in the UK, Neil, and your NHS is famous for a great line: "No decision about me without me." And I think Simon Stevens was so right when he talked about truly person-centered healthcare. And it sounds so cliche-ish, and it sounds so classic Madison Avenue-ish to talk about buzzwords and phrases about person-centered healthcare. But at the end of the day, doctors are there to help you get better and to respect your wishes. And when they need to know that the most is when you can't tell them because you're in a crisis. So just do it in advance. It's a pretty logical, common sense solution to a massive disconnect that we have in healthcare all over the world.
And looking towards the future, what's your grand vision for My Directives? Is there anything that you're really aiming for?
If you couldn't tell by now, we have a very grand vision, and that's everyone in the world over the age of 18 to have a plan.
Yeah.
Have gone to mydirectives.com and create a plan. If you did one on paper and you want to upload it, you can push the button and upload it and just leave the paper version in our cloud account as well. And then we're going to help you get your voice heard anywhere there's a crisis anywhere in the world where they need to know what you want and what you don't want. So for us, it's a very simple vision. It's a hard challenge to execute on, and that's what we have to work so hard every day. And we're blessed to work with the most amazing people. But the challenge is that everyone over the age of 18 have a plan, keep it updated, keep it current, keep it relevant, keep it meaningful. We hope you never need it, but in the event you do, it's there.
And finally, just for anyone listening that would probably asking, going to have one more question that they might want to ask. And that's let's say something was to happen to me and I've got that plan in place. I've got the app on my phone. At what point does it kick into my wife? How does that communication piece happen from something happening to me and getting that communication to my wife or whoever?
Well, keeping it a fairly simplistic view, we call it the push and the pull.
Yeah.
And the consumer has the ability to push their voice to lots of people, an unlimited number of people you can share links with. You could print it out on hard copy if you'd like and hand it to somebody. You could carry a wallet card. You could sync it to the medical ID on your iPhone. And we're honored to be the Advanced Care Plan partner for Apple and the medical ID concept. So you have the ability to push it to anybody. And then, as I was saying earlier, the healthcare system increasingly is using our sophisticated suite of API and enterprise tools to touch our database and find it in the event that you can't tell them that it's there. And we hope they hear about it from multiple ways. We hope they found a wallet card in your wallet if you were brought in on an ambulance journey and the paramedic is seeing something on the way in and says, oh, here's Jeff's wallet. And, oh, I found a wallet card and it says he has an account at My Directives. And then when they get there, they find on my telephone that they can reach my wife. And she says, you know, he has a plan at My Directives, but I'm on my way there anyway. And then the electronic health record in the hospital automatically has touched the cloud and pulled back the link to the most recent version of my Advanced Care Plan at My Directives. And now the doctors see it triangulation and they see it in multiple points of direction. And now they feel really confident that they can execute because the plan has consistently come to them from different places, but the content is all the same. It's not as if one version was 3 years old and somebody runs down the hall and says, I talked to Dad last week or 6 months ago and he hasn't had time to update it yet, so this is the most recent version. Or someone else says they have the most recent version. All of that confusion can really be solved in today's digital world if intelligent players work together on a common set of content and transport standards and make sure that at the center of all this is the opportunity for the consumer to get their voice heard. If that truly happens, then all of us have a great sense of pride in knowing that we've revolutionized healthcare for the right reasons. We're giving people a chance to have a voice in their care.
Fantastic. And for anyone listening, I'm conscious we have covered a lot of ground today. And if they got further questions or they want to just sign up or watch the TED Talk or anything else, can you just point them in the right direction to get all that content?
Absolutely. It's mydirectives.com, MyDirectives Mobile, info@mydirectives.com. You can go out on social media and find us as well under the My Directives brand. We're thrilled to have a chance to visit with you, Neil, today and your audience, and appreciate very much everything that you do to help bring opportunities for people to realize that they can make a difference and change healthcare.
Well, I always say at the end of every episode that technology works best when it brings people together. And what I love about what you're doing here is, yes, you're bringing those loved ones together at a time of crisis, but you're also ensuring that everybody can get their voice heard if they do suffer that health crisis and cannot communicate with family, doctors, nurses, or other caregivers. It's such important work, and I love how you've brought technology in there to do that. So thanks so much for joining me today.
Thank you so much.
Jeff's passion and dedication really shine through talking to him there about how technology can usher in this new world of transformation across healthcare tech. But his conversation also made me realise how most of us leave so much to chance, just assuming that we will be healthy and able to communicate forever. And how that smartphone that's sitting in our pockets could be put to so much better use than just endlessly scrolling down Facebook, Instagram, Twitter and LinkedIn each morning. And I think we often talk about how legacy technology is holding people back. But isn't it also a legacy mindset that also needs upgrading? Because we could better manage our life and every stage of it too. My big takeaway here is that this is such a simple concept, but 13 years later, Jeff is still trying to get governments and leaders around the world to do the right thing and just make it easier to give people a voice when they need it the most, rather than just see it as a revenue opportunity and almost hold them to ransom. And so, Jeff, even though you are the first guest to make me cry on this podcast, it was off air, so I'll let you off. And I salute you for the great work that you're doing here and giving everyone a chance to get their voice heard by leveraging technology and that smartphone that we've all got in our pockets or possibly in our hands right now. And there are many reasons that I found today's episode quite poignant because it's a subject very close to my heart. For everyone listening, is there anything that you'd like to add to today's conversation? Whatever it is, if you've got a subject close to your heart and you'd like to come on and talk about it, or you'd just like to leave a little comment, or even just ask me a question, whatever it is, email me, techblogwriter@outlook.com, Twitter, Instagram, LinkedIn, just look for me at Neil C. Hughes, and my website is techblogwriter.co.uk. But that's it for today's episode, I'm afraid. And a big apology from me also, because I believe there was a problem with the Apple Podcast RSS feed a few days ago, which essentially meant you had no episodes from Wednesday last week. And then suddenly 6 or 7 dropped all on the same day. I apologise for that. It was a problem at Apple's end. It was nothing that I did. I wasn't just trying to test you by dropping all the episodes at once. But apologies from me. If you can forgive me, maybe you'll join me again tomorrow and we'll do it all again. So a big thank you for listening. And until next time, don't be a stranger.
Thank you for listening to the Tech Talks Daily Podcast with Neil C. Hughes. Remember, technology works best when it brings people together.